Thermal burn, definition of burn and diagnosis of burn injury. Burn is one of the common causes of trauma, and its incidence account for about 30% of all trauma patients. Burn occurs in wartime, life, or work. Severe burns will cause skin scars and disfigurement to patients, which will affect the patient's quality of life seriously. Currently, with regard to treatment of burns, in addition to early first aid for improving the survival rate of burn patients, it also includes strengthening the early prevention and treatment of post-injury scars and the rehabilitation of possible dysfunction, thereby promoting the early return of burn patients to society and improving the quality of life of burn patients. Quick and accurate diagnosis of burn injuries and timely treatment will improve the outcomes of burns to the utmost extent and reduce the disability rate and the case fatality rate caused by severe burns. Contents of thermal burn. Main contents: definition of burns and diagnosis of burn injury, field aid, patient transportation and initial treatment, pathophysiology and clinical staging of burn, treatment principle and wound management, burn shock, systematic infection of burn, prevention and treatment of common visceral complications. Today, we're going to learn the definition of burn and diagnosis of burn injury at first. Burn refers to the tissue injuries caused by flame, hot liquid, high temperature gas, laser, hot metal liquid or solid, electronic or chemical substance, etc. The injury factors are included in the definition, such as film, hot liquid, etc., as well as the injury position included, which includes all tissues of human body, mainly skin and mucosa. Depending on the depth of the burn, it can also reach bones, muscles, and even viscera. This is a broad definition of burn. We will learn the injuries caused by electrical and chemical substance later due to some specific particularity. What we mainly learn here is the burns that we usually call, that is, human tissue injuries, mainly caused by thermal factors, namely, narrowly defined burns, account for about 90% of burns. We are used to call the thermal burns caused by hot liquid and steam as scars in life. After being burned, the most frequent asked question by patients or family members are whether it is severe, whether it is dangerous, and when it will be recovered, whether it will cause scars, etc. As a doctor, how to answer the questions of patients and their family members, and how to treat patients properly. The first step is to diagnose the burn injury quickly and accurately. It mainly refers to the estimate of burn area and judgment of burn depth. Burn area refers to the percentage of total body surface area, TBSA, affected by burns. It is used as the basis of judging the severity of burn patients and the basis of anti-shock treatment. At present, the new row of the row of knives and the row of palm are often used to clinical estimate. New rows of knives. Taking an adult male as an example, 90% of head and neck, wherein head, face, and neck account for 30% each. 9% multiply 2 for 2 upper limbs, wherein 2 hands account for 5%, 2 forearms 6%, and 2 upper arms 7%. 9% multiply 3 for trunk and perineum, wherein the front and rear parts of trunk account for 30% each, and perineum accounts for 1%. 9% multiply 5 plus 1% for 2 lower limbs and buttocks, wherein buttocks account for 5%, 2 feet 7%, 2 chorea 30%, and 2 thighs 21%. We have a relatively simple memory formula, namely 3, 3, 3, 5, 6, 7, 30, 30, and 1 for genitalia. 5, 7, 30, and 21. While adult women have relatively large buttocks and small feet, each account for 6%. Children have large heads and small lower limbs, and the area is related to age. The area of head and neck is 9 plus 12 minus age. And the area of 2 lower limbs is 46 minus 12 minus age. The area of upper limbs and trunk are the same as adults. Another area estimate method, rule of palm. The area of single palm is equivalent to 1% of body surface area. There are 2 points that shall be noted here. Number 1, the palm is the palm of the patient. Number 2, the area is the area of the single palm after the fingers are brought together from the transverse wrist cases to fingertips. The method is more convenient for estimating small area burns. It can be applied in conjunction with the rule of 9s in the estimate of large area burns. Before learning the judgment of burn depth, let's first review the structure of the skin. The skin is mainly divided into epidermis, dermis, and subcutaneous tissue. The thickness of dermis varies greatly in different parts of the human body. So, there are certain differences in clinical manifestation or burn involving the dermis. And present, the method of 3-degree and 4 categories is generally used, namely 1st degree, superficial partial thickness, deep partial thickness, and full thickness. And the method of 4 degrees and 5 categories is also used to classify the full thickness burns involving burns extending to deep facial, such as subcutaneous muscle and bones, as the 4th degree. In the method of 3 degrees and 4 categories for judging the burn depth, where the 1st degree burn only extends into the epidermis and the genital layers is intact. So, it heals in about 3 to 7 days, mostly 4 to 5 days, without scars, and there may be pigmentation in short term. The clinical manifestation include erythema, dryness, and burning sensation on the surface. The superficial partial thickness burn extend through the germinal layer of epidermis and papilla layers of dermis. It wounds heals by the remaining germinal layers of dermis and skin appendages. The wound usually heals within 1 to 2 weeks, and generally no scars are left, but there may be pigmentation. The clinical manifestations include apparent local redness and swelling, the formation of blisters of different sizes containing a light yellow clear liquid, and red and moist base with severe pain. The deep partial thickness burn extends below the papillary layer of dermis, with some reticular layers remaining. Because the thickness of dermis varies in each tissue, so the depth is different. Because there are remaining skin appendages in dermis, wound repair can rely on the epithelioses to form epithelial islands. If there is no infection, fusion repair can be achieved through extension of epithelial islands, which takes 3 to 4 weeks, but there is scar hypertrophy. The clinical manifestation includes blisters, slightly wet wound in red and white, and slight hypergesia. The full thickness burn extends through the full thickness of the skin, which is also called Escher-type burn. If it extends to muscles or even bones and visceral organs, it is also called the 4th degree burn, because all the skin and its appendages are destroyed. The granulation wound will be formed after eschers desquamatis in 3 to 4 weeks. Small wounds can generally be repaired by epithelial growth of healthy skin at the wound age, and large wounds generally need to be repaired by skin grafting or transfer of skin lamp. Mostly, scars remaining after healing, which affect the appearances and function. Therefore, the prevention and treatment of scars have been strengthened clinically. It shall also be noted that the burn depth division is artificial. In fact, the various burns is not uniform in depth, and they are migrant to each other, so that the depth is not easy to recognize immediately after the injury. The burn depth can also chart with the cause of disease. If the wound is infected or not treated in time, the wound may be exacerbated. If the wound is treated in time, some status areas of deep partial thickness burn wound can be rescued, so that it would not be exacerbated to full thickness burn. The judgment of the burn depth mainly depends on the visual observation correctly, lacking objective indicators, which is often not accurate enough. There are many researches on the test methods for objective and accurate evaluation of burn depth and present. Burns are often divided into 4 degrees in China, including minor, moderate, major, and extremely major burns according to the burn area and depth. The minor burn refers to less than 10% of partial thickness burn for adults, and it halves for children. The moderate burn refers to 11 to 30% of partial thickness burn, or less than 10% of full thickness burn for adults, and it halves for children. The major burn refers to 31% to 50% of partial thickness burn, or 10% to 20% of full thickness burn for adults, and it halves for children. If the burn area is less than 30%, but one of the following conditions is accompanied. It also belongs to severe burns, including in complications such as shock, respiratory tract burns, or heavier compound injuries or chemical poisoning. The extreme major burn refers to the burn with a total burn area more than 50% or more than 20% of full thickness burn, and it helps for children or is accompanied by severe complications. We have mentioned the concept of inhalation injury here. It is formally known as respiratory tract burn, which refers to a burn caused by the inhalation of harmful chemical substance contained in heat, smoke during burns, dust during explosions, etc., and is a severe burn on the special part. It is generally judged by the medical history, symptoms, and sign. Number 1. The burn site is relatively enclosed. Number 2. Patient breathes with difficulty, with respiratory irritation, cough carbon sputum, and is in a hoarse voice. Number 3. There are deep burns on face, neck, mouth, and nose. Vibrates are burned, and a thymius sound can be heard in lungs. Therefore, when asking the medical history clinically, attention shall be paid to the inquiry of the injury environment, whether it is closed environment, whether the doors and the windows are closed, and whether there was a call for help at the time. During the physical examination, it is necessary to check whether there are burns in patient's mouth, nose, or oropharynx, whether there are burned vibrates or even black powder. Listen to the patients for harnesses and escalate the lumps for whistling rail. If necessary, the otolaryngology department and respiratory department may be asked to carry out the laryngoscopy and fibroscopic bronchoscopy to further confirm the diagnosis. Patients were not burned to death by flames, but died from asphyxia. We will discuss the second part of the thermal burn, field aid, patient transportation, and initial treatment in the next lesson.